Welcome to the Asheville View. I'm Aisha Adams, and today I'm here joined by my lovely co-hosts, Tina White, Myriam Weber, and Kahlani Jackson. So today we're talking about how statewide there are over 400,000 open job opportunities, 51,000 in healthcare alone. Locally, many restaurants are struggling to find workers. In Asheville, there are 23,301 job openings, but not enough workers. We only have 8,600 unemployed people. Prior to the pandemic, our region had the lowest unemployment rate in North Carolina for 61 consecutive months. But when the pandemic hit, we went near to the highest in the state. Do you know people who are still sitting it out or changing employers? How have you been affected by the job climate? What needs to change to motivate people to re-enter the job market?
I keep hearing about these people who are sitting it out. I don't know any of them. I know lots of people who are changing jobs. I know quite a few who found jobs recently and who've been looking for a long time. I actually think this is why I like capitalism. I think it solves a problem. And for a long time, the last 30 years, capitalism has been focused on the wages of professionals and executives. And I consulted to a lot of global corporations who often wanted advice on how do they entice these top echelon people. They never asked about the rank and file, but they were happy to pay more money to offer more benefits. And now we're seeing this model finally work for workers, everyday workers, where companies are having to step forward and say, well, how do we attract more people? I was intrigued in one presentation I saw recently, they gave 9 strategies. The last one was raise wages. And I think it's healthy to see our economic model finally turning to people at the bottom and thinking about how do we increase their wages? How do we give them better benefits? And to see those people empowered to hunt for jobs. I feel for entrepreneurs who are facing these shortages. It's not good, but one great thing about our model is it's very good at adapting to problems like this.
Yeah, and for me, I'm an entrepreneur here in Asheville, North Carolina, and things that have happened in my business, I see that there is a shortage of like people wanting to come in and booth rent and work in the salon because they can stay at home and get unemployment. So it's been me being an entrepreneur, it's really made me have to change my business model to find ways that like work for me to keep the business running. Sometimes you have to work more hours, but if someone's sick, which that just came up this week, you kind of have to pivot, get tested, make sure you're safe, make sure your clients are safe. So this has really just made me be more flexible with my time and also be very thoughtful of the steps that I take to keep my business running.
Kahlani, has it changed? Have you had to think differently about employees than you used to?
Yeah, definitely. Just in the sense of safety, that's like number one. My clientele, I have all ages. So you just want to make sure that people are healthy, that they're being responsible, that they're following like testing. With me being an esthetician and we're cosmetologists, we've already been taught like how to clean and sanitize because that just goes with our profession. So when COVID hit, things really didn't switch up that much because we've already been taught like a standard protocol, but pretty much, you just want people that are really responsible and honest because this is what's going on right now. You really have to be on it because things can change at a drop of a dime. Like we were shut down for 2 months during the pandemic, so.
In my line of work, I'm a teacher in public schools. And at first we were one of the very few school systems who completed the whole year, almost the whole year virtually. We were very safe. We made sure that we shut down immediately and stayed shut down And even when we came back by the end of last year, it was very small numbers and kids were in little hubs. But at the same time, we were promised a lot of things that were going to happen to keep us safe that didn't happen and are still not happening. We lost a lot of teachers this year. We still have a lot of open positions. We still have a lot of classrooms with substitutes. Kids are not getting the education that they deserve to have because these teachers and these school employees, and I'm not just talking about teachers, are not really getting paid well enough to do that job. We don't have enough people to do that job. And now that we're in a time where sanitizing and cleaning are such a priority, those people who do that work need to be appreciated and paid, and we need more of them. You cannot have 3 janitors in a huge campus and expect, and especially you promise the community that these rooms are going to be sanitized. They're going to have air filters. Air filtration happens in some schools and not others. Some elementary schools have those filters. Some schools have none. So it's very, like you said, Kahlani, you have to be honest with people and with your workers. And I feel like that is not happening. A lot of the kindergarten enrollments is down because a lot of people are homeschooling because they don't feel comfortable. But schools have to be open. We know that now it's a necessity, but at what cost? We're not being told what's going on. The schools are not distancing, they're overcrowded. We are sanitizing as much as we can. But again, our job has gotten so much more intense. We're responsible for the kids who quarantine. We have to make sure that they still keep learning because there are no virtual options. So it has gotten so much more intense with the anxiety of catching a disease or bringing a disease to your home. And the additional, you have to sanitize, you have to clean up, you have to do all these things after each day, which is not easy. So I feel like a lot of people in my line of work have changed the line of work because of burnout and because of not feeling safe and feeling that there's not a lot of honesty about it because everyone is trying to keep the schools open, but at what risk they're putting the students and the teachers at risk. And this is a huge reason why a lot of teachers have switched jobs. I know teachers who have gone to fully remote teaching and teaching for remote academies, which I must say, it is nice to just wake up and get a cup of coffee and, and not have bus duty or lunch duty or, just.
Yeah, but in my work, Myriam, like I'm working. So this pandemic is like, okay, Aisha, you say you are a diversity, equity, and inclusion expert. Get me some diverse hires in this building. Like that's basically like the conversation we're having. And so I'm having to have a couple of conversations with employers. And the first one is, can I no longer hear about your living wage? Because it's really a rude concept to think that you're going to pay somebody just enough to live.
Yeah.
Right. Because if I am getting a living wage, that is the bare minimum that I need to survive, which means I can't take a class. I can't get a certificate. I can't get a raise because I can't get a new skill set to even get better at the job that I'm in. Right. And so what we have to do is stop talking about, well, I'm a living wage employer and say I'm a thriving wage employer and play people in a way in which they know that if they come and work for you, that they get to thrive and that they get to grow and that they get to be better people and that they can see a sense of a pathway to better from working with you. And so I liked how Tina said there are all these other strategies we can employ even before wages, right? So I think it's super important for me, like you said, it must be nice to roll out of bed. We learned in COVID, everybody doesn't have to show up to the office.
Exactly.
We see that if you're going to pay somebody $36,000, the least you can do is not make them come into work every day, right? Like it's the least as you can do to make that burden easier on them, and they can still get the job done efficiently and effectively. so that you get what you need at a lower cost to them, right? Because there's gas and oil changes and tires and all the things that come with wear and tear for daily driving into work. There's so many other strategies that we can use. Be good to people. Just be like really good to people, care about people, show up, make them feel like they're a part of the team. A lot of times, you know, that goes a long way. People want to show up for the other people that they work with. You know, when I was a teacher with Myriam, a lot of my days are showing up in things that I really didn't feel like doing. It was because I know how hard the other teachers worked and how much they cared about each other. So it's always interesting to me to see how COVID has affected like all these different sectors, from the nonprofit sector to education to entrepreneurship to DEI work. COVID has really sort of taken over and really is this extra lens. Luckily in my work, that is a part of the DEI lens. But it's been just interesting to see. I worked with Mayhead on their CCRT team, and to see the care that the doctors put into making sure that everybody really had access to the vaccine. They did a beautiful job of working on that, and it's still not enough, you know? And this idea of cleanliness and this idea of sanitary, I don't think there's enough social media about it, enough explanation about it, enough talking about like, okay, there are some people who are vaccinated, there are some people who are not vaccinated. The people who are vaccinated are not safe, and the people who are not vaccinated are not safe. So the next best option is cleanliness, to be sanitary and to take care of one another and to wear our masks. And so like all of that stuff is affecting how people show up at work. And then my only other last point is you'll know that America lost 200,000 people due to the pandemic. And we're not acting like some of those people actually worked. And that's a big part of this shortage. It's almost like we've become numb to the fact that we've lost 200,000 Americans way too soon.
Yep.
Right. And what is that effect of the job market?
That's correct. Yeah.
So you've been watching the Asheville View, and we'll see you next time.